In this lesson, we'll continue our discussion of fractures by taking a look at the pathophysiology. We'll then take a look at the stages of fracture healing, some potential complications, signs, symptoms, and then we'll take a look at some treatments. So let's begin by looking at the pathophysiology. Once a fracture happens, there's going to be an inflammatory response and then something called hemostasis, which just means the stopping of bleeding. So let's talk about the bleeding first. Once the fracture happens, there's definitely going to be bleeding from blood vessels that are inside the bone. If you remember from anatomy, bone is very vascular. And then also there's bleeding from the blood vessels within the periosteum. So as there's bleeding into the fracture site, give this word a little highlight right here. A hematoma forms. Hema means blood, and then oma means tumor. So there's actually a tumor of blood in the fracture site, but that's important because that's going to serve as a basis for new tissue to grow. We call this tissue granulation tissue. Right? So we need to have this bleeding into the fracture site. At the same time as bleeding is happening, there's going to be necrosis at the bone end. So whatever bony fragments were at the bone ends or jagged edges, they're going to undergo necrosis so that we can start with nice new fresh tissue. Now, in addition to bleeding, we're also going to get an inflammatory response. This develops from the trauma and the presence of debris in the fracture site. So we're going to get inflammation inside the bone. Between the bleeding and the inflammatory response, we're going to get edema. Right? Edema, is swelling. So the swelling may cause stretching on this periosteum if the periosteum is still intact, and that's also swelling of the tissues in the area. So the edema will also be as a result of the swelling of the tissues in the area, and that is going to cause pain. Our periosteum is very highly innervated by nerves, so if you stretch that periosteum, it's going to produce pain. We do have a release of chemicals at the site of inflammation. Bradykinin is one that we know from the pain lesson. There's other chemical mediators that also contribute to the pain. And some patients may even get a systemic inflammatory response. They may have systemic signs, maybe fever or something like that. Okay, so these are the things that are happening from a pathophysiological perspective. So once the fracture happens, the next thing that we want to take place is healing. We're going to divide healing into five distinct phases. The first one we're going to look at is hematoma formation, then the granulation stage, the formation of the procallus, the formation of the bony callus, and then finally we'll take a look at remodeling. So we have mentioned this before. Once the fracture happens, there's bleeding into the fracture site. That's actually the first phase of healing also. Right? So the first thing that's going to happen is that we're going to have a hematoma, and within that hematoma, there's a whole fibrin network. Fibrin is like the strands from clotting, and that fibrin network is going to serve as the basis for our next phase where new tissue is going to be laid down. So this is what we're going to call the granulation stage. During this stage, there's general cleanup. Phagocytic cells are going to go in and just clean up whatever debris, right? We don't want to build new bone on old debris that's there. We want to get rid of that. Fibroblasts, which are a type of connective tissue cell, they're going to come in and they start to lay down the new collagen. And at the same time, chondroblasts move in, and they're going to begin to produce some new cartilage, right? So we're starting to lay down new tissue between collagen and some cartilage. From there, we're going to move into the procallus collar phase, right? Or some people call it the fibrocartilaginous collar. This is now going to be where the granulation tissue is going to be replaced by fibrocartilage, and at this point we're going to have union of the two fragments. We'll have union of the proximal fragment and the distal fragment. Now it's not strong, right? You wouldn't want to go out and play sports and do activities. It's just the cartilage connecting the two bony fragments. Over time, that fibrocartilage is going to be replaced, or that procallus is going to be replaced by bone. That's going to be the fourth phase of healing that we call the bony callus. Right, the procallus is just going to be replaced by bone. Now, the cells that produce bone are known as osteoblasts. They're located in the periosteum and the endosteum, and they basically will replace the fibrocartilage by new, strong, hopefully, bone. And at this point, we would have bony union. Again, initially it's going to be weak, but over time it's going to get stronger and stronger. Now, sometimes, and this is the last phase, the bone will go through months, up to a year, I guess, of remodeling. And it's just interesting if you ever look at a pre and a post X-ray, right before healing starts, and then once healing ends and remodeling ends, sometimes you can't even tell where the fracture was. The remodeling is so good. So think of this as the final stage. It's a combination of the osteoblast and osteoclast. Now, these break down bone, remodeling the bone based on the stresses that are placed upon the bone. And this is where physiotherapy, going for physical therapy, it's just so important, because as you put stress on the bone from exercise, it will remodel itself. And like I said, it can take months, but sometimes, again, the job is so good, the remodeling is so good that you can't tell where the fracture took place. So here's a picture from our textbook that shows these stages that I just went over. So let's just go through this real quick. So up over here, we can see the fracture site. This is the proximal segment up top where my cursor is. And then this will be the distal segment down over here. And you can see there's bleeding within that fracture site. So that's going to be our hematoma formation. All right, so that's the first step. Now, in the second step, we get rid of some of that necrotic bone, right? Some of the dead bone in there, some of the bone fragments. We have to start clean, right? We can't have a old bone stuck where we're going to be building new bone. That doesn't work. The clot starts to retract, but now we start to bring in some granulation tissue, which is going to be the collagen. The chondroblasts here are going to start to bring in some cartilage, that type of thing, right? So this is where we now have the granulation stage. We're starting to um, fill this blood clot with granulation tissue. Over time, that's going to be replaced by cartilage. So this is going to be the procallus. If you look in here, this is going to be cartilage tissue here, right? Fibrocartilage tissue in here, also in here. So now we have union between the proximal fragment and the distal fragment, but the union is by cartilage, and we get this whole ring. It goes right around the bone, right, all around the bone. This is going to be the callus collar. Now, over time, that fibrocartilage is going to be replaced by bone. So if you notice over here, we have the bony collar now. See how we have that right out here, right there. That's going to be bone replacing the fibrocartilage. Bone right here replacing the fibrocartilage. And eventually this will be replaced, and then our medullary canal during remodeling is going to come back. And so this would be the bony collar that's forming here, or the bony callus, I should say. And finally, you'll see remodeling. So this will be early remodeling. You can see the swelling over here is starting to reduce. See how it's swollen out over here? That callus, that starts to be reduced. We're starting to get our medullary canal back. And then again, if a good job was done with the remodeling, right, you can even tell where the fracture was, right? Nice medullary canal, where you have your nice compact bone over here, and healing is done. And again, that's why, again, physical therapy is so important, to make sure that the best remodeling will take place. So let's take a look at some of the factors that affect bone healing now that we know how bone heals. Number one is the amount of local damage. And obviously, if there's more damage, right, the healing is going to be much more complex. Maybe it's going to take longer. Right? Maybe we're going to even have complications, that type of thing. The proximity of the bone ends. This is where setting the bone is so important, getting those bones as close as possible. Also, if there's been any foreign materials, impaled or anything like that, or if there's any infection going on, that's going to have an effect. And then also, if the patient has any comorbidities, right, comorbidities, any systemic problems that they're dealing with, maybe they have a blood vessel problem where they don't have good blood supply to the fracture site. Maybe they have anemia. Maybe they're diabetic. Maybe they have nutritional deficits, or they don't have enough important things for healing. Like vitamin C, believe it or not, vitamin A, right? Vitamin B. These are all vitamin K. These are all important things for healing of bone, and they may be on glucocorticoids, which would also be a problem. Okay, so these are some of the things that affect bone healing. So let's take a look at some of the complications of fractures. There's a number of them that can happen. Number one is muscle spasm. When the nerves are irritated from the fracture, right, the swelling around the fracture site and the periosteum, there's a reflex of muscle spasms that helps to try to stabilize the body's the fracture area, I should say. Another complication would be infections. Let's just say there was a compound fracture where the bone has broken through the skin, or if they had to do surgery to reduce the fracture. Again, anytime there's surgery, there's a risk of infection. Ischemia is another problem that can occur. Remember that ischemia is when blood vessels are not bringing blood to an organ or a tissue. So this can happen if a cast is too tight, or if there's actually continued swelling in the cast, and as the swelling occurs, the pressure builds up inside the cast, because we know that a cast is not going to expand, right? It's rigid. So that could result in ischemia because the blood vessels are being compressed by the increased pressure. Another complication is something known as compartment syndrome. Um, this occurs with extensive inflammation. So whenever we have extensive inflammation, usually they're seen with crush injuries. There's an increased pressure within the fascia. We know that the fascia, the deep fascia that's around muscles, let's say in the leg, it doesn't. It's not elastic. It doesn't stretch. So if we build up inflammation within the fascia, now we're going to get increased pressure inside the compartment of the leg, let's say, and now that compresses blood vessels and nerves, and it's a true medical emergency. Sometimes they have to do a emergency surgery to release the pressure, right, to get things back to normal. Right, so the patient will have severe pain. They'll have the ischemia, right? The blood vessels become compressed, and then hopefully it doesn't lead to this, but it could actually cause death to the muscle tissue. Like I said, they'll do like an emergency surgery to release that pressure. Some other complications of fractures, fat embolism, right? If the bone breaks and in the medullary canal there's some yellow marrow, which is fatty bone marrow, that can get into the bloodstream. There could be nerve damage, failure to heal. Just that, again, sometimes with people, the bones don't heal together, and they have to do different types of physiotherapy and electrical stimulation. Sometimes they can do to get the stimulate that bone to heal. There could be the development of a permanent deformity, right? So maybe there's not going to be, a nice new straight bone again the way it was previously, or there could even be residual effects such as osteoarthritis, which we'll talk about in a subsequent lesson. Okay, so what are some of the signs and symptoms of fracture? Number one is going to be pain, right? So the severe pain may even cause the patient to go into shock. There are times that people fracture a bone and they don't know it, or they even find it on an X-ray later, in their life, and they didn't realize they did have a fracture. There'll be swelling and tenderness at the fracture site. If it's a compound fracture, the bone will break through the skin and there'll be an open wound. There may be a deformity. Again, if depending on the mechanism of the injury, the bone may be deformed. Crepitus is a grating sound that you hear as the bones move across one another. Sometimes that happens when they're trying to realign the bone, and you may hear a little bit of a grating sound. And a lot of times, even with the severe pain, there'll be some nausea as well as some vomiting. So we'll finish up this lesson by taking a look at the treatment of fractures. Right? Most of us know that the first thing we have to do is reduce the fracture, right? They call that fracture reduction. Basically, all they're doing there is restoring the normal position of the bones. Most of the time they can do it closed. They take an x-ray, they realign the bones, put a cast on it, that type of thing. But an open reduction is the term they use if a surgical intervention is necessary, right? So they may even have to insert a pin, a screw, different plates and rods, that type of thing. You see that a lot when somebody has like a comminuted fracture where there's multiple fragments. Okay, and that's the treatment of fractures.